Hello, how are you my people? I hope you're doing well. So today's video is just a clarification on some of the series of the videos that I've been doing on HPV and cervical cancer. So thank you for the love, thank you for the subscribing, thank you for watching and sharing with your friends. So let's get right into it. So if you've been watching my videos, you know what is HPV, but I just remind ourselves that HPV stands for human papillomavirus, which is a virus that is directly linked to cervical cancer. And in our last video we talked about screening methods, and one of the major screening methods and a new technology that has actually been piloted in our country and mostly in Africa is HPV tests. So in today's video I'm going to be highlighting on HPV test and what does it mean to be HPV positive. So once you do an HPV test as one of the screening methods, the results can come out as either positive, negative, or invalid. So what does it mean to be HPV positive? So HPV positive means that they have actually gotten the virus that causes cervical cancer in your body. And we have so many types of HPV viruses, but only type 16 and 18 are the major ones that have been now linked to cervical cancer, especially in the African region. So an HPV positive test means that they have found those HPV traits, that is type 16 and 18, in your vagina, cervix, or part of your reproductive organs that is known to cause the cervical cancer. So according to the algorithms in terms of HPV treatment or HPV infection treatment, so once you've been found to have HPV virus in your body, the next step is to do now the VIA to be able now to determine whether the kind of lesion that you have is possible to be treated using an outpatient method, that is the pre-cancer stage, that can be treated in the outpatient method, or you need advanced care. So at this point whereby they are doing a visual inspection is now to check your cervix and to check if there is now advanced disease or is there any type of recommendations for treatment that can be done for you. So in terms of now treatment, if the lesion is found to be less than 75% covering the cervix, you can be treated using either thermoablation or cryotherapy. If the lesion is bigger and is covering a bigger space, they can use LEEP. But now if they found that the lesion maybe it is advancing to other parts of the cervix or the surrounding regions in your cervix or surrounding organs rather, then now they need maybe chemotherapy, radiotherapy, or things like that that are more advanced. But the good thing is that when it's caught early, cervical cancer is 100% treatable. It can actually be treated and you can live a normal life. The only problem is that most of the people will wait until symptoms appear. And when we said about the symptoms of cervical cancer, when you talked about them, is that when you're already seeing the signs and symptoms, mean that it's already late. So the message is home. Let's get screened as early as possible if you're within the age limits that we talked about, that is HPV test, which is 30 years and above. So just to wrap up this video, I would like to make a statement in terms of HPV and its positivity. So the reason why, first of all, we are testing 30 years and above is because HPV is a very common virus. Since it's sexually transmitted, if you have ever had sex, most likely you might get it at some point in your life. But good thing is that HPV can clear from your body within, normally they give 15 to 20 years or 10 to 15, actually 10 to 15 years. The virus can clear from your body. But then what is known to cause cervical cancer is when there is a persistent infection with the high risk steps that we talked about. So just because you have HPV virus doesn't mean that you'll get cervical cancer. You just need to be screened so that they can determine which type of virus is it, and then you'll be advised accordingly. And the last thing kabisa, 10 women are dying every day from cervical cancer in Kenya. So get screened today, don't wait. Thank you, and see you on the next video.